I'm gonna like move these so I'm not tempted to use them. Hello, everyone. If you wouldn't mind telling me if you can hear me right now, just give me in the comment section, yes, I can hear you. No, I can't. Tell me if you can. For the most part, I think you should be able to hear me, but we will test. Can you hear me? Yes, no, yes, no. Just let me know. Before I start answering questions, I want to make sure that you can actually hear the answers to them. I'm getting the thumbs up from across the room that you can hear me. Thanks, Diane's. I love how the first two people that answered were Diane's. Okay, so I have a whole slew of pre-submitted questions. You're welcome to, as we go through this, put some questions into the comments here. I will answer them as we get through them. I should be able to get through most of them depending on how long we're together today. I'm going to start with some that have been emailed. I've got another screen beside us here, so that's why I'm kind of looking away. But I will try to address them one by one here. So first question is from Peggy. This one's for you, Peggy. How would you suggest getting started on gaining strength, endurance, and balance for someone that has recently had several surgeries, cancer, and other medical issues? So there's a really good chance that a lot of you, this will apply to. It would apply to me. I've had many surgeries. I haven't had cancer, but I've had some pretty nasty other stuff happen in my life as well. And for the most part, it just needs to be slow. You need to start slowly and systematically. One of the things that you want to be doing when you're starting right from the get-go is usually give yourself something that you know you can succeed at. And so for a lot of people, that means going for a walk. For some people, that might even be too hard. It might just mean doing a couple of laps up and down a few stairs in their house. For most people, you just want to make sure it's something that you can succeed at. So set a very low bar and make sure that you can hit it. What's really important after that is to make sure that you are continually, I'm going to pull this closer to myself here, that you're continually taking small steps forward. For the most part, if you've had a history of surgery or cancers or other such things, there's no reason that you can't exercise. A lot of the time, it just means that you need some specific considerations. What I would not do, because this is part of the question later, is I would not jump into a class right away. And the reason I say I would not jump into a class right away is because even with highly qualified instructors teaching a class, they can't cater everything just to you. Only you know you at the start. So if you're going to work with someone and you're going to pay someone, I would even take some time if you need to and save up some money to pay a personal trainer or pay someone that's going to be able to pay one-on-one attention to you, even if not for every single session that you do, just to be able to keep track for you, meaning you should be able to have someone do an assessment, figure out where you are, and say, start here, come back and see me in a month. We'll see where you're at, and we'll potentially progress from there. But classes are even with great instructors, and I've taught classes myself, they can't be personalized. And when you have a complex medical history, you don't want to be starting with classes as your entry point if you're worried, if you have a high degree of complexity in these things. So that's where I would start. I would skip on classes and I would just start very, very slow and then try to get a professional that will agree to coach you potentially once every few weeks or once a month that you can bring your problems to, you can bring your desires to, and they'll give you some direction and hopefully you can go from there. That would be very much where I would start. So let me go back to my inbox here. So this question is, should I add weights to knee and hip exercises? So for the most part, yes. When you have the capacity to add weight to almost anything that we do, you should. And one of the reasons I say that is because as we age, the amount of muscle that we have, which is very important as we age, it has nothing to do with just whether or not you look good. It has a lot to do with your capacity. The amount of muscle that we have is directly correlated with the amount of weight that we can move. And resistance training, meaning using external weight, is generally predictive of how long you're going to be self-sufficient and how great you're going to feel. So your health span, as opposed to lifespan, which is the age at which you die, your health span is the age at which you become, you change from being self-sufficient to being reliant on others. And that is definitely going to be correlated with whether or not you can use weights. So I know people that are in their 70s that can move hundreds of pounds, and I know people that are in their 20s that don't choose to use more than 5 pounds for anything. I would way rather you be the person that is not afraid to move some weight, and just realize that there's going to be aches and pains along the way. That's normal. Doesn't mean you're doing damage. But yes, when at all possible, add weights to things. Just do it slowly and systematically over time, but don't be afraid to go pretty hard on these things. So this is a question that is very specific, but I'm sure it will apply to a few of you, is how do I deal with a Baker's cyst? And this email is coming from someone who's 80. And the reason I wanted to address this is not an age-related problem. A Baker's cyst is a big fluid-filled sac in the back of your knee. It often comes with some other issue. The reason I wanted to address this, even though it might not apply to all of you, is because it's very common, and there's not a lot you can do about a Baker's cyst. A Baker's cyst is considered secondary to another problem, meaning it is not the problem. Almost invariably, a Baker's cyst shows up as a result of something else going on inside the knee. So if a doctor won't drain it, that's good. That's normal. Standard of care says that you probably shouldn't drain it. But it usually means there's something else going on inside the knee that needs to be addressed. And if there's nothing that a surgeon needs to address or wants to address, I'd highly recommend you go find a physical therapist and see what they can do about it. If nothing else, hopefully they can make it hurt a little bit less and potentially make you a little more mobile, because a big Baker's cyst can be a problem. But I mean, just as an example, I have a patient who's a professional athlete. He was literally in this room with me last week. He's in his late 20s. He's got a Baker's cyst. His knee doesn't really hurt otherwise. He's got some small issues in it, but it's a Baker's cyst. His doctor told him the same thing. They won't drain it. They won't do anything to it because it's reflective of something inside the knee. So a Baker's cyst, for the most part, if you're not on the list to have some kind of knee surgery or not going down that route to fix whatever's going on inside the knee, please get to a physical therapist, and one that generally deals with a lot of knees. That'll probably be your best bet as far as a Baker's cyst goes. So this has to do with stooping over. It has to do with posture. The question here is generally becoming stooped from degenerative back and neck vertebrae, and they're looking for exercises to fix it. So here's the reality, is that there's not a lot of research showing that we can change a lot of it, but most of what most people in my world would imply that you should probably do is going to be upper back exercises and neck exercises. So a lot of it has to do with how our body stabilizes. And if it's degenerative, meaning it doesn't necessarily have to hurt, it just means that the shape of your bones and discs and things are starting to change. We can't stop that process. We can't even change that process, but it doesn't mean it has to hurt, and it doesn't mean your posture has to change. I would recommend doing some foam rolling more than anything, probably in your upper back, starting with a very, very soft foam roll. And practicing, rather than trying to pull yourself into a big upright position, practice mobilizing your upper back and making it nice and pliable and movable, and then getting in the gym and training. There's almost no one out there that shouldn't be doing some kind of weightlifting, and a lot of it is because what weights will do is the same thing gravity does. It tries to pull you to the ground, and what you're doing with weights a lot of the time is you're teaching your body how to fight that. You're teaching your body how to fight gravity, how to fight that forward stoop. And so mostly getting in the gym and actually training some things that are difficult for you, that are going to make you want to stoop over, will actually train your body to fight it and do the exact opposite. So things like deadlifts and things like rows and upright rows, where you're picking up heavy weights and you're pulling things towards you, can be very great for these things. There's no guarantee that it's necessarily going to change. Sometimes it will, sometimes it won't. I've seen it change in a lot of people, but it doesn't have to change. Just because it's there doesn't mean that it has to be an issue. We tend to put a cultural norm on upright posture being the ideal, but the reality is it doesn't have to be that way, especially later in life. Kind of what we consider poor posture is not actually bad posture. It's just normal posture, and it's something that most people aren't going to have any issues with. It means that it's not going to cause them pain. It's not going to cause them any discomfort. It's just probably something they want to change for aesthetic purposes. But most people, it's not the cause of their issues. All right, let me work my way back through. So I think this is actually a question that's being asked in the comments and by email, saying this is from someone who's had a right knee replacement 3 years ago, and now they have hyperflexion, which means the knee is unstable and locking backwards. This one's for you, Debbie. Because of this, she has to use a walker from a fear of falling. So when it comes to the knees, there's a whole bunch of different muscles that cross the knees. What I would be spending a lot of your time doing is probably exercising your hamstrings, which is the big set of muscles that's on the back of your upper leg. So if you're sitting in a chair and you had to shove your hand underneath your thigh, what you'd be grabbing onto is your hamstrings. And a lot of the reason is because the hamstrings, you probably want to get them a little bit tighter and a little bit stronger, because if they're a lot stronger and tighter, they're going to prevent your knee from hyperextending. So your knee kind of bends. What she's talking about is your knee will bend like this, and what she wants to stop is this from happening. It's kind of locking backwards mechanism. And that is something that can be a side effect of a knee replacement. The nice thing about knee replacements, they usually take away the vast majority of your pain. The bad thing is that they're not built like a normal knee. They're built like something mechanical, and so they don't operate like we normally operate. But I'll be working a lot on different hamstring exercises. There will be a lot of them in some of the knee programs that we have on Better 5. You can find some online in other places, but hamstring exercises are going to be pretty important to you because that's what's going to stop it. I can't give a lot of other specific advice to this scenario because every knee replacement is slightly different. But I would definitely work on trying to get, honestly, very strong through your legs, especially through the back side of your legs, meaning your calves and your hamstrings. That's going to be the most important thing that you can go do. That will very likely help with that. There's no guarantee it's going to fix it, but if I were you and I had a knee replacement and I felt the same kind of thing happening, I would be focusing very heavily on strength, and I might even consider getting a knee brace that just prevents that. Just so that your body gets a little more confidence in being upright and walking, and you don't have to use a walker. So going to an orthopedist or going to a physical therapist that can recommend where you get a knee brace, that's just going to stop that from happening. And there's a lot of different options out there for braces that do that. Let me see. So this person seems, this is Phyllis. Hi, Phyllis. I hope you're here listening. Had a reverse shoulder operation many months ago, still going to physio. After this was done, I had lots of balance problems. I used to love walking, but cannot endure it any longer. Who should I see to get my legs in working order again? Pain and bad circulation. So Phyllis, this is a very specific scenario, and the reason I say that is because it is not common for you to get balance issues after shoulder surgery. It might be a side effect of the things that they had to use to knock you out, because they have to put you out to do shoulder surgeries. I've had surgeries in a few different places, and you have to be unconscious or it becomes unsafe. And so sometimes this can actually be a side effect of the drugs that were used to make sure you're unconscious during the surgery. So the reason I'm saying that is I would highly recommend that you go see your doctor, your family physician, even just a Zoom consultation to mention this. And say, you know, I'm worried it might be a side effect of the drugs, because certain drugs will make things worse, especially antibiotics for certain people. So I've had dizziness issues myself before from concussions. And I recently got an eye infection, and I had to be on antibiotics for 2 months, and I was dizzy for 2 months straight. It's actually a very common side effect. It might not have anything to do with your legs, and it might not have anything to do with the pain or the circulation. It might have to do with the drugs. So I would first rule that out and talk to your doctor about it. And if you're on antibiotics, especially, there's a good chance that it's related to that. Secondarily, what I would do is find a vestibular physical therapist. There are some physical therapists who specialize in balance issues. And there's a good chance they'll also know a lot about shoulders and the things that you're dealing with. So vestibular, because your inner ear is called your vestibule. So a vestibular physical therapist, ask around, try to find who you can. And even you can probably Google it. There's certain places online. I don't remember the exact address, but I think it's vestibular.org, for instance. And they have listings of people that specialize in these things. That's what I would be doing. There's a good chance it's not related to your legs. It's probably related to do with your inner ear or something different. So, because it's not common after shoulder surgery for that to be a problem. So I would make sure you find some help for that one. So this has to do with some side effects. This is from Barbara. Hi, Barbara. I hope you're listening. So Barbara was doing a strength and mobility seated chair exercises for the knee. And she experienced a sharp pain from her knee into her foot. So without going into anything else, this probably actually has more to do with your back than your knee. And the reason being, there's actually almost no structures that connect your knee to the inside of your foot physically. The only things that physically connect your knee to the inside of your foot are nerves and blood vessels. And blood vessels are just very unlikely to cause a sudden pain unless it's something really severe. But you'd know if that was the case. A lot of the time it's a nerve. And if it is a nerve, there's a really good chance it's coming from your back and not coming from your knee or your foot. It can be coming from your knee, but if it's going down to the inside of your leg, to the inside of your foot, there's a really good chance that it's a nerve-related issue. And the reason I say that is because, and that's not a guarantee, it might be that there's something else going on in there, but most commonly that's going to be something that's actually coming from further up the chain and might have had more to do with the fact that you were seated, less so to do with the knee issues, especially because it says when she stood up and walked around, it seems to get less sore. So if you're walking around and something gets less sore, if it was a true knee issue, that wouldn't be true for most people. If it was acute, meaning something just popped up. But if it was your back, there's a good chance it is true. What I would do again is I would probably seek the care. Of someone who's qualified, a physical therapist, chiropractor, medical doctor, to take a look at it. But if it happened just this once and it doesn't happen again, which is very common, it happens to everyone of every age. They'll get a sharp pain or something really uncomfortable. It seems really bad, and it will go away. And if it only happened that once, I would just keep going. Keep doing the same exercises, see if it happens again. If it happens a second time, the same sort of thing, then you definitely want to make sure you're seeking care for it. So for most people, a one-time pain, even if it's quite bad, as long as it's not persistent over hours and days, usually you can wait it out, try something new. There's a good chance it's going to go away on its own. But if not, I would make sure you see someone that is going to be able to look both at your back and your knee. All right. So this is from someone who's in their 70s and is having trouble standing up straight in the morning, which is fairly normal. So when you're in your 70s, let me talk about the spine for a second. One of the things that happens when you get to your 70s is that certain parts of your spine change, and it starts at around the age of 50. So most people, the peak of back pain comes at around the age of 50 and actually gets less after that. And can be quite bad through 30s, 40s, and 50s for people. And a lot of that is because the discs in your back, which separate the bones, so you have bone, disc, between all the 24 vertebrae in your spine, those discs actually start to dry out, physically desiccate. They become less like steak, more like beef jerky. And that sounds like a problem, but for a lot of people, it's actually a gift. It's a good thing, because as they dry out, they become less susceptible to injury. They become tougher. It's harder to chew on beef jerky than it is to chew on a steak. And the reason I'm saying that is because it tends to be that as we age, things get stiffer, but they are less likely to get injured. And so the base question here is, it takes about 30 minutes to warm up in the morning and to get moving before this person feels like they can straighten up. And stretching doesn't seem to change much. It's not something that I run into all that often. And one of the main reasons is I tend to run into it in younger populations when they have disc problems. So what I would do is, instead of doing some stretching in the morning, is I would do what's called a prone press up. Some intentional extensions of the spine, where essentially you are on your belly as if you're going to do a push-up, and you start to press yourself up onto your elbows, but you don't actually let your hips stay off. So you end up in this kind of curved position where your head is up here, your hips are here, and your legs are down here, where you're doing this sort of thing, and you're kind of just slowly easing yourself into spinal extension. Because most people can't stand up early in the morning if it's an issue, because their spine doesn't want to get upright. With that being said, there are some other issues that are significantly more common as we age, and that can have to do with degeneration in the spine, causing a change in how your spinal cord moves. So if it turns out that first thing in the morning you also can't lift your head very well, and you get a headache or you get a lot of pain in your back or into your lower body, it's really important that you go see someone about that. If it's just purely stiffness, and it's just as hard to get upright, and it's not really a whole lot of pain, but really stiff and uncomfortable, but then it wears off, that's fine. But if it turns out it's associated with a big pain, it could be something called stenosis, which is not common, but it is more common when people hit their 70s. So hopefully that helps. So this has to do with asthma, which will be common with a few people. So I've been diagnosed with mild or exercise-induced asthma, breathing hard these days, only when walking up a hill, especially when wearing a mask. I hear you on that one. Used to be a runner, but only do restorative yoga twice a week now. What is the best way to improve breath capacity or breathing capacity? So for a lot of people, I'm just going to talk about asthma for a quick second. For a lot of people, asthma is something that can change, and a lot of it will change with dietary changes. A lot of people will be able to find that they get more lung capacity if they actually change the global amount of inflammation that they have and the chemical state in their body. Because breathing, the amount that we can breathe, after all, is a very chemical process. That's not to say it's guaranteed that's what's happening here, but it is something that can be changed for a lot of people. And what I would probably do is find a naturopath, to a naturopathic doctor, to see if that's something that they want to take a swing at. Because there's a chance that it is not entirely something that you're going to have to deal with all the time. There's a chance that you have some chemical process, either an autoimmune process or food-related process, that can actually make this whole thing better. But if that's not the case, what I would do is, for the one thing, if you have asthma, it actually is important to exercise. It's just important to do it very slow and very graded. As you've probably experienced, if you have asthma, most people are usually fine until they hit an inflection point, and then it becomes panicky and it becomes a problem. So what's important is that you exercise often, and you exercise just at the verge of that, but you don't push beyond that point where you feel like you need an inhaler or you feel like you need something else. Asthma is a tricky one. I would also work on potentially foam rolling the upper back and getting a lot of physical work done through rib cage and upper back from massage and foam rollers and stretching and those sorts of things, just to make sure the actual physical sac that is your lungs actually has full access to its full range of motion. Hopefully that helps. All right, some of these are a little specific, and I'm getting through these. I've actually, good, we're only 22 minutes in. I will definitely get through all these emails. I've only got about 10 of them left here, and then I'm going to jump right into your comments here. So if you threw one in there, I'll get to it in a second. So, this person is asking about a spondy, which is short for spondylolisthesis, which essentially means if your vertebrae are all stacked one on top of the other like this, that one of them has started to slide forward. Most commonly the very bottom one. L5, the bottom lumbar vertebra, usually tends to slip forward on the sacrum, your tailbone. So for most people, the movements that aggravate that, this is the question: what movements aggravate this and what can make it better? The movements that tend to aggravate it tend to be extension-based exercises, meaning things where if you were on your belly, you were going to look up towards the ceiling like an upward-facing dog. And it tends to be that flexion-based exercises make these better, things like standing and touching your toes. They don't necessarily have to make it a whole lot better or worse. The conventional thinking is that extension is going to be mildly aggravating, flexion is going to be mildly relieving, but that's not the case for everyone, so you've got to be able to figure that out. When it comes to what makes it better, the research shows there's essentially nothing that's going to pull this thing back. So if you have a spondy, it's there, but it doesn't have to hurt, and it doesn't have to really change anything about how you behave. More than anything, it's actually just very important that you do a lot of exercise and that you do a lot of core and midsection and hip exercise, and try to make sure that you're actually doing things that will help your muscles understand how to control it and keep it where it is. Most people, a spondy is in some way degenerative or idiopathic, which just means we have no idea where it came from. One of my best friends when I was going through college, he was 21. He was the youngest person in my class. He was, very intelligent fellow, so he got into school early. He had a spondy, and he was a 21-year-old Asian man who was a high-level hockey player. And all we really did was avoid doing extension-based exercises with him. As long as he did other exercises, he was fine. So a spondy is not by any means a sentence to you only doing certain things. You can do almost anything you want. Probably just avoid a lot of heavy extension-based exercises, especially the type that you would find in McKenzie therapies and in yoga, just because they're extravagant. That's about it. Almost everything else that you're going to want to do is just going to be exercise that anyone else would do, and you probably want to even exercise at a higher intensity, meaning that you really want some weights, you really want your muscles to demand a lot, because it'll help quite a bit. So associated with this, this person's asking about the piriformis and IT band syndrome, and then being often very, very tight. So with a piriformis, probably the number one thing you can do as opposed to stretching it is actually going to be foam rolling it. And there are lots of ways that you can find foam rolling videos for the piriformis. So you mentioned doing a foot over the knee figure 4 position. You do that sitting on a foam roller where the foam roll is side to side across your butt cheeks, and you lean onto the side that you have your foot up on and roll around. It will be horribly uncomfortable because it'll be working directly on your piriformis and on the sciatic nerve in that area, but it'll actually help for the vast majority of people. I would recommend foam rolling over stretching almost any day of the week for a piriformis in an IT band. It's very uncomfortable to start with, but for most people, after about 2 weeks-ish of doing it for 2 to 5 minutes a day, it will be a world of difference. It takes some time, but it does actually make a big difference. Hopefully that helps. That's one I've had issues with. Foam rolling sucks, but it helps. So, burning muscles in the mid-back, pain in the mid and upper back, a really common one. So the main thing that is going to help with upper back pain is, again, it's actually going to be exercise. It's going to be weight training more than anything. So even though those muscles feel tight and they feel like they're overused, exercising them is the main way to get them to calm down. So one of the things that exercise does for our muscles is it allows us better control of our muscles so that they don't just have to hold on tight all the time, that you actually have a little more like a dimmer on a light switch or a thermostat where you can turn them slightly up or slightly down. Exercise doesn't just give us strength, it gives us control over the tension in our muscles as well. So one of the ways that you're going to find you're going to get the most benefit out of upper back exercises is just doing a lot of them, doing them aggressively, doing them heavy, and it will usually help that to calm down. Secondarily to that, I would say foam rolling the upper back. I know we've got it in a couple of our courses. I don't remember which ones. I've demonstrated it a ton of times. But foam rolling your upper back, specifically foam rolling it into an extension pattern, will really help with a lot of people. But most people, when they have a burning muscle ache in their upper back, a lot of it has to do with their postures, how they're spending a lot of time all day. So interrupting your habits will help a lot, but strengthening and foam rolling that upper back will really help. And I ran into this all the time in clinical practice. One of the most common things people will come see me for was pain between their shoulder blades and their upper back. And usually foam rolling and exercise is the way to get rid of it. So, I'm not entirely sure if there's a question in this email. I don't see it. All right, gonna have to move on. So this is this has to do with spine surgery, which a few of you will have had, so I'll cover it. This person says, I've had back surgery to remove discs from L2 to L5 and titanium rods installed from L2 to S1. So that essentially means you've had a back fusion, which stops your low back from moving. I've had a lot of people who have had this surgery. Everyone from someone that broke their back in a motorcycle accident to people that it was degenerative, to people that have had disc issues, all of them. I've seen a lot of these. 73 and in good health otherwise, although I do have some arthritis in spine and knees. Done a lot of physical therapy and can now walk, but not very far as my low back gets very tight and tired. I also have foot drop, which appears to be muscular in origin, but could be neurological. Is it safe for me to follow your programs? I've tried the foot and lower leg strength and shoulder ones with difficulty, but lower body strength program was challenging. Should I persevere with it, as this is the weakest part of me, or stop doing it? It does cause some sciatic pain, but only from my right glute to just below where my new hip scar ends. So this is a really, really common type of question that I get. Essentially, I've had a surgery, I've had a problem, can I do your programs? And the vast majority of the time, the answer is yes. And the reason I say that is because during any of the programs that I've created on Better 5, what you'll now hear me say at the start of them is, if it hurts, see what happens if you try it 1 or 2 times, and if it continues to hurt, then you can skip it or you can alter it. So there are very few things. I mean, the nice thing about especially titanium rods, you can't really hurt them. They're titanium, which is nice. It doesn't mean that you're going to want to push through to things that are uncomfortable. But if you have titanium rods and metal built in, it's almost impossible to re-injure that area. And if you were going to, it's not the kind of exercises that we're doing. But with that being said, it is really common that people get really, really tight in the low back after they've had these fusion kind of surgeries. And the reason I'm saying that is because normally, if someone was really tight and they didn't have these kind of surgeries and no fusions in their back, we would get them to move their back around in some specific ways. But titanium's not going anywhere. So one of the things I would do if this was me, and I've had 2 disc herniations in my back and a few disc issues as well, I would get some massage. Because if you're getting really tight in the low back, I would do some massage and I would do some core strengthening. One of the things that muscle tightness shows up for is to try to control your body, meaning your muscles are the only brakes that you have. You know, not that our body is like a car, but if it was like a car, the only thing that moves our body is our muscles, but the only thing that stops our body is also our muscles. So a lot of the time, if we have a tightness that shows up repeatedly over and over again, it's usually our body wanting to stop something from moving that it can't stabilize very well. So doing core stabilization exercises, even after something like a hip surgery and a low back surgery, as long as it's not recent, you still have stitches and these sorts of things, slowly working into stabilization exercises will usually help a lot of these tightnesses to go away. With that being said, you mentioned foot drop in this email, and that is something that we don't want to mess with. So you never want to make that worse. If you get foot drop and it seems muscular, that's great. As long as you got that information from someone that's reliable, perfect. You're probably fine. But if it is coming from your back, you just want to make sure that you're tracking that, because what you don't want is to do some exercise, get up, and your foot drop be instantly worse. As long as it's getting better within a couple hours after, it's probably okay. But most of the stuff that we can do, you can alter it. It's not going to be bad for you. But again, you've had enough surgeries, enough stuff going on. Just start slow, be very careful, make sure that you're getting a healthcare provider on your side that can tell you whether or not you should do these sort of things. This is a very unique one. I'm going to quickly cover it. I have a paralyzed diaphragm from an anesthesiologist hitting my phrenic nerve when putting me to sleep for a hand surgery. So even hands, they still got to knock you out for these kind of surgeries. And that is very, very rare, by the way. Hitting a phrenic nerve is actually hard to do. Most people couldn't do it if they tried, but paralyzed diaphragm would mean that breathing is probably going to be an issue. I can barely walk or move without being unable to breathe. I am now on oxygen to help with my breathing. I need to exercise sitting down. Is there any kind of exercise I can do to strengthen my diaphragm area? So I'll say this. The question is kind of a moot point. Try to strengthen your diaphragm area if you have a damaged phrenic nerve. Doesn't mean it's not going to come back. But if you have a phrenic nerve that isn't doing what it's supposed to do, there is no way for you to strengthen your diaphragm. It's not going to work for now. You're going to have to wait it out. And the reason I say that is you have accessory breathing muscles that try to help you breathe. But the way your diaphragm works is it's a dome and it drops down and it pulls down and it pulls air into your face, into the holes in your face. And if your diaphragm is currently paralyzed or currently not working due to something with a phrenic nerve, which I've had 2 similar issues of someone actually getting me in a nerve when they didn't need to, with an anesthesiologist being one of them. It's a wait it out, unfortunately. You definitely can exercise. You can definitely do it while you're seated. But one thing you might not realize is your diaphragm actually is a stabilizer as well. It doesn't just help you breathe; it helps you stabilize. But if your diaphragm's not doing its job, for the most part, you're going to have to kind of wait it out. And I know that's unfortunate, but there's not a lot that you can do to wake it up besides just constantly keep going about your day-to-day life, trying to breathe as you would. And there's none of the stuff that we're doing that you wouldn't be able to do with a diaphragm that isn't working properly. It's just going to be significantly harder for you, so you're going to want to make sure that you're going slowly. That's all. So start slow on all these things. All right, that one doesn't apply here. I'm 73 years old and had a left total hip replacement 4 years ago. Now pain-free, fortunately. That's awesome. Congratulations. I'm due for hip surgery in September of this year, so I'm hoping to be pain-free after that as well. That said, I find that my left hip is still not as strong as my right hip and has less range of motion. Specifically, if I'm seated and extend my left leg, I'm unable to rotate my leg or hip laterally to the left. Are there any exercises I can safely do to give me the range of motion I have in my right hip? Which exercises are not safe for me to do? So if you've had a total hip replacement, it depends. There are different models, but for most people, it's really just the extremes of range of motion are what you're going to want to avoid. So you don't want to be doing like a figure 4 pose or really cranking your your leg into any different massive amounts of rotation. So a lot of the time, people do have a weird incapacity in certain ranges of motion when they have had surgery, when they've had a hip replacement, a knee replacement. A lot of these things, they take a long time to come back. And some of that is because where your muscle attached before might not be where it's attached anymore, because they have to take all the muscle attachments off of the bones, replace those bones with titanium or something similar, put the muscles back on the bones, or back on the titanium and those sorts of things. So there's a chance that weakness is something that is an incapacity due to the way that your morphology has changed, the way your build has changed. It might not have anything to do with it being a problem. It might not actually have anything to do with an injury or something that we can train out of. Maybe it is, but 4 years later, there's a good chance that your right and your left hip are just different. So if you have, and this is the same for any joint replacement, the range of motion is going to be different. You're going to be weaker on one side than the other in specific ranges of motion, not necessarily weaker in the one that you got replaced. But all I would do as far as avoiding exercises is avoid the extreme ranges of motion, especially as far as going out to the side, lifting your leg out to the side, which most people never get very far in that range anyway, and especially when it comes to flexing your knee up to your chest and twisting your leg across your body. That's about it. Almost everything else you can do. Most other exercises, as long as you can get into that range of motion, what I would do is give yourself an assist. Meaning, if you get into a range of motion, you find that your muscles just aren't capable of getting you there, try to find a way to use an exercise band or a stretching strap or your hand to lift your leg into the position that you want, and then try to hold it there. That's usually the best entry point to get into these things. Is I can't get into that range of motion yet, so I'm going to artificially put myself in that range of motion, as long as it's not something that feels dangerous or unstable to you, and then slowly let go of the thing that got you there and try to hold. Usually that's one of the only ways we're going to start waking these things up. Hip replacements are notorious for this. I have friends and patients who have had hip replacements that they come to me however many months or years later and say, I can't do this range of motion. And it's just that range of motion is accessible to them, but they can't produce force in it. And it's just, there's no magic to it besides getting into that position repeatedly, learning how to create force with a little bit of assistance in the form of lifting into that position and trying to help yourself. But it's a slow go. I wish I had a little bit of a better answer for you on that one. Already answered that one. Already answered that one. All right. We're moving on to the captions now. So I'm sure I've answered for a few guys here. So first question here from Jan. Hi, Jan. Hopefully you're still here. Hi, Dr. Ben. Any advice for pec, collarbone, and front of neck tightness that makes breathing feel tight at the top of an inhale? Other issues have been ruled out, most likely from job or repetitive motion. So for a lot of people, getting some form of self-massage in there will really help. I'd highly encourage you to get like a soft, like a practice lacrosse ball or a self-massage ball, even a variety of them. There's some different packages you can find on Amazon that you'll get at different sizes and densities. And I would start working along under your collarbone here. I would start working along the side of your neck here. And I would start working along in your upper traps there. And for the most part, as long as you're not going over this part here, which is a blood pressure sensor in your body, as long as you're a little further back in through here, you can go to town on that kind of stuff. It's not something that is going to be all that comfortable for you. But what I might also do is I might find a really good, and the reason I say really good is maybe you've already seen one that's not helping you, find a really good physical therapist or a chiropractor. I'd actually probably start with a sports chiropractor, look for a sports one, because there's a really good chance, I've seen stuff like this before, there's a really good chance that there's something that's just not quite sitting right, that you can get a really good adjustment and will fix a lot of it, or you can get a really good rib or collarbone mobilization that will open things up very magically. It's not very often that I tell people that they should just go see someone to do the work on them. I like to give people the work to do themselves. But Jan, I will say this is one of those scenarios where I would go find a really good sports chiro, go through a few weeks of treatment to see what happens with some adjustments, some mobilization, some manipulations in the area, specifically the lower neck, the sternum where it hits the collarbone and the shoulder joint. And I wouldn't be surprised if that takes care of a lot of it. And if it doesn't, there's a good chance they'll give you other recommendations. Debbie Doyle, I see you on here. I got to your question in our emails. So Mary is asking if I can add weights to knee and hip exercises. I think I mentioned this already, but definitely yes. The more weight you can do, and the longer you can do it for, the better. So Julie's asking, I have painful tight knees. How can I improve my ability to sit back on my heels? So this is going to depend a little bit on exactly what's going on with your knees. So if you're older, and by older I mean 70s or 80s, and you have knees that are big and they're degenerated and they're starting to get arthritis in them, you probably don't want to force it. It doesn't mean that you can't sit on your heels, but you probably don't want to force it. What most people are going to find, if you're 30s, 40s, 50s, even 60s a lot of the time, if you want to sit on your heels, one of the things that's easier a lot of the time is actually to wedge something behind your knee. And one of the reasons being, it'll wedge your knee open a little bit so that it's not quite so compressed. And give yourself a systematic approach. By that, I mean, start with saying, I'm going to set a timer. I'm only going to do this for 20 seconds. For the first 10 days, I'm going to do 20 seconds at a time, a few times a day. And then the next week, I'll do 30 seconds at a time. The next week, I'll do 40 seconds at a time, or whatever it might be. Just don't overdo it. As you've probably experienced, trying to put your butt on your heels and sitting for a long time, it can be really uncomfortable when you go to get up. So start really low. Wedge something behind the back of your knees, just like a rolled up face cloth or a beach towel or something that you can really tuck tight into the back of your knee when you sit your butt on your heels. It should allow you to start and then slowly progress from there. So Mary is asking, say, I have a diagnosed issue with venous insufficiency and lymphedema in the legs. Bad circulation causes my legs to feel heavy and numbness in my feet. Any special classes that will help? Special classes, no. You can definitely take most of our classes, but we don't have anyone specifically to address this that I know of. With that being said, if you write an email to the Better 5 team, they might tell you otherwise. I know I haven't created any. There might be some on the way. But I don't think we have any specifically for it. But with that being said, most of the time, as you probably experience, compression stockings, but other forms of compression can help quite a bit as well, such as a gentle version of voodoo floss, which you can look up. Voodoo, just like when you think of voodoo dolls, voodoo floss will help in certain ways. Compression therapies, you can look up a company called Normatech, which does graded compression therapy with a machine. They're really expensive, but if you can afford it, they're absolutely wonderful. But for the most part, we don't have anything specifically to address that, but there's no reason that you can't do most of our stuff anyway. Trish is saying, I have sciatica in my left leg. Now notice so much in the back of the shoulder on the left side. Is sciatica affected by my shoulder function too? Not directly. The reason I say not directly is they are not particularly connected. Your whole body is going to work as one big unit, and there's a chance that they're connected by one compensating and adapting for the other, but very minor. I wouldn't worry yourself with whether or not they're connected. I'll say that. There's a slim to small chance that they are, but even if they were, there's really no way that we can go about proving that, and there's really no way, a systematic way, that any kind of therapist is going to be able to pick out the one piece that connects them and work on it. So for the most part, you probably have two different things going on. It's not to minimize them by any means. I'm sure they're both very important to you, but it's very unlikely that they're both connected, at least physically. They could be, but if you were a patient of mine, if you were in my office, I would treat them as different problems. I would not treat one expecting the other to change. So Mary Jane is saying, I have scoliosis, age 81, can't stand straight, pain in left leg and hip. I've done several Better 5 courses. Any I should or shouldn't? For the most part, I would say not necessarily. If you have a scoliosis, a true scoliosis, it usually just means you're going to have to be adaptive with a lot of our courses. So what I would do is, honestly, almost any of the courses that I've done, some of them are going to be a little bit advanced, but most of them should be fine. All I would do is get yourself a collection of different size foam rolls, yoga blocks, bolsters, pillows, and a lot of this just so that you can wedge yourself in place to do a lot of the exercises. Because you're not going to be shaped kind of like the prototypical torso is shaped. You're going to have different curves and different movements. What I would do is just try to find some things that allow you to do the exercises. Because most of them, there's no reason you shouldn't be able to do them. But again, it's going to be very different person to person and depend on the severity of your scoliosis. Some people will say scoliosis and it means they have 5 degrees. Other people will say scoliosis and it means they have 70 degrees. There's some huge variety in that. But assuming you're on the more extreme end, I would just find a lot of ways to wedge yourself in place on chairs, on the floor. You should be able to do the exercises in a lot of the courses anyway, especially the beginner exercises and especially the chair-based exercises that we do. So you should be able to do a lot of them. So Tina says, I love chair Pilates. I can't stand up from kneeling. What exercises do you recommend for strengthening? I'm 69 and just started exercising. So for one, congratulations. 69 is a great time to start exercising. It's always a great time to start. So I know people that have started in their 90s. There's no reason you can't do it. And you've still got quite a while before that. Can't stand up from kneeling. For one thing, we do have a free course that you can find on Better 5 on how to get up off the ground. So I'd first go and take that, and not just take it so you understand it logically, but I would take it and practice. Practice getting up and down off of the ground. Another thing I would do is I would strengthen your legs and your core. Any of our classes that are core and leg strengthening are going to be quite helpful. But more than anything, I try to come up with different strategies to get up and down off the ground. That will help you quite a bit. So I would start by taking our course, practice it repeatedly, because there will be a certain fitness aspect to it and a certain skill aspect to it, and try to figure out the way that works best for you. But when it comes to exercises, there's no magic one that's going to help with getting up and down from kneeling. But what I would do is, practice more than anything else. Mac is asking me, boxers or briefs? I used to wear boxers. I now wear boxer briefs. So we're going to go with both. Great question, Mac. Moving on. I've had bad pain in my meniscal area, which is in the knee, since tearing it nearly 2 years ago. I've done all the correct physio, had it repaired, and now had 3 PRP injections. So I'm jumping ahead here because there was others in between. So far, there's little improvement. Any ideas for where I should go next? I'm doing some bike work, wearing the correct trainers, leg brace, regularly doing exercise, which is quite limited due to discomfort and pain. I cannot really walk for more than 20 minutes. So what I would do, Gabriel, depending on your pronunciation here, is I would go and find a really good manual therapist. I would look for someone who does active release technique. They might be a physio or a chiro or a massage therapist. The reason I say that is because in my experience, if this is a meniscal problem and it's not getting better with the stuff that you just mentioned, it probably needs some physical work to happen to it. It probably needs something to happen specifically to the meniscus. So finding a sports doc or a sports chiro in your area, specifically one certified in active release technique, I think will really help with that. It's a technique that I was certified in a long time ago, and I use it for meniscal problems. And I would go and look for someone with that. There's no guarantees it's going to help, but if that was your next step, I think that would be a good starting place for you. Val is asking if I have a course that focuses on weights and less on cardio. I do. I have a couple of them. I don't know if they're published yet, but we definitely have some in the works. I know that for sure with me and with a few other people. And I'm really glad you're asking this, Val, because weights are so important. Cardiovascular health is one of those things that is very likely to be very important for as far as how long we live. Cardiovascular disease is one of the top killers of anyone. But being able to lift weights, being able to be strong is one of the main predictors of whether or not you're going to be independent and really enjoy your life. So weights are very important. I really like that you asked this question. And this is not, you don't have to be an athlete. You don't have to desire to, hike Mount Everest to want to use weights. It's just going to make you have a better life. I know we have some in the making, and if we don't have them now, they're coming. Don't worry. Patricia is asking, what are the best exercises for someone with 5 compression fractures in the lumbar area? That's a lot of compression fractures. So honestly, if you have that many compression fractures, I'm going to assume that they're not due to an accident. I'm going to assume that they're due to osteoporosis or osteopenia. If they are due to an accident, then honestly, you're going to want to see a therapist for it because there's probably a lot of other things going on. But if it's due to osteoporosis or osteopenia, which are very similar to each other, it's going to be anything that is going to get you slowly and incrementally weight bearing. So weight training and resistance exercise are going to be very important, and nutrition is going to be extremely important. If you're at the point that you have 5 compression fractures in your lumbar spine and it's from osteoporosis, there's a very good chance that the 2 most important things in your life are going to be eating a lot more high quality foods that are going to help your bones and your body maintain itself, and doing weight bearing exercise, meaning you're doing things that put weight on you that challenge your bones. The bones adapt to force. It's one of the ways that they get harder is you make them do hard things. It's just like anything in our body. So muscles will grow bigger sometimes they don't. But bones will grow denser. They'll grow thicker and they'll grow more resistant to force. So honestly, the heavier weight that you can use over time, and you don't want to start there, but start with heavy weights, start with light weights and work up over time, the heavier the better. Not knowing anything about your age, but I'll just take a shot in the dark and say you're a 65-year-old female with osteoporosis, I would hire a personal trainer and start slow, because you want to be moving heavy weights so that this kind of stuff doesn't keep happening. There's really no replacement for it. Right. Gabriel again. Nope, these were the ones with the meniscus tear. Judy. Spot in my left side back midway down. I'm going to assume you mean down there somewhere, which is where a lot of people have issues. I think I pinched a nerve. It's in the muscle because I can pinch it and it feels like a hot poker. Massage, ice pack, salon has helped. Anything else I can do so it eventually comes back? First thing, it's not a pinched nerve. The reason I say it's not a pinched nerve is because there are almost no nerves in the area that travel in any way that can be pinched. But a lot of people, when they feel a really sharp burning pain in a small area, they say pinched nerve, but there's only a few things in your body that will ever actually be pinched nerves. It doesn't mean that it's not really uncomfortable, because I've had things that are really uncomfortable that have nothing to do with the nerve and feel like a pinched nerve. But it's almost no chance there's a pinched nerve going on in that area. And if it was, you would have some other really weird symptoms going on, which we don't have to get into here. I'll say this, very unlikely a pinched nerve. What I would do is start foam rolling. It's going to be something I mentioned repeatedly, but foam rolling your upper back, where you're giving yourself a big hug and placing the foam roll on the ground or even starting on the wall and rolling up and down your spine, letting yourself relax, letting yourself ease into it. Foam rolling is probably the number 1 thing you can do to try to get moving on that as much as you can. And once foam rolling becomes easy for you after a couple of weeks, I would also get into getting a lacrosse ball in there. And a lot of people, I don't know if you've seen a chiropractor. Again, I would probably go find a sports chiropractor, and specifically one that does active release technique, which I talked about just a moment ago. A good adjustment will fix a lot of things in that area. It may not fix them permanently, but it will give you the opportunity to retrain the area. And probably most importantly, on top of all this, is some kind of strengthening, some kind of strength training, because it's not about needing strength in the upper back necessarily, but it gives your body the ability to control just how much tension it uses in the area. And there's a really good chance that this has more to do with either a neck issue or your upper back not moving and muscle tension than a pinched nerve. So I would foam roll a lot, like 5 minutes, 2 or 3 times a day, do it for 2 weeks, then move on to a lacrosse ball, same thing in the area, see a chiropractor, get a couple of adjustments, see if that helps, and definitely make sure you start strengthening along that path. So, Maureen is asking about moving kneecaps. So in the knee courses, I talk about jiggling kneecaps, and it's actually very common that people kind of go, oh, that's weird. I don't really want to jiggle around my kneecap, because she's had a meniscus tear and arthritis in both. You still want to try. You just want to be gentle. So for one thing, your kneecap is nowhere near meniscus. It will have zero impact on your meniscus whatsoever. So if you're afraid of the meniscus tear, it literally will never touch your meniscus, nor will it impact the joint that your meniscus is in. So your meniscus sits in between your femur and your shin bone. Your kneecap hovers out here in front of both of them. It doesn't actually touch them, nor will it ever, unless you do something horrific to it, like a car accident level kind of thing. It won't touch it. So definitely not touching your meniscus. And when it comes to the arthritis, that's even more of a reason to do it, to try to maintain that mobility. Just start gentle. You can go top to bottom very easily. You can go gentle side to side. You should still be able to do it. Wiggling that kneecap is one of the things that will help a lot of the fluid in your knee to go where it needs to go and move how it needs to move. So jiggling a kneecap is, there's a reason I put it in a ton of my knee courses, because it's one of the basis of getting your knees to move the way that they should. We are getting close to the end here. I'm getting the signal we have 5 minutes left, which is great, because we've got about that much worth of questions left. So, someone from Greece is listening in. When in the morning, when I wake up, my back hurts on both sides and I feel really sore and inflexible. I also get cramps in the inside of my thighs when I get out of bed. So, nice to meet you, Costa. Welcome from Greece. I'm sure it is not a convenient time of day in Greece for you to be here, so thanks for coming. For the most part, I would say as long as it goes away, it's nothing that you necessarily have to worry about. But one of the things that I would check about, if you're getting cramps and you're getting sore in a lot of different places, there's a good chance that it doesn't have a whole lot to do with your muscles or your spine or these other such things. It probably has more to do with the chemical situation in your body. Because Cramps sometimes can have to do, and a lot of the times do have to do with how we move. But if all this is happening first thing in the morning, it might have to do more with your hydration and some of the other things that you're on. I would actually take a look at whatever pharmaceuticals you're on, if you're on any kind of drugs, on your hydration status. Make sure you're getting a little bit more water in the few hours at the end of the day before. And if nothing else, I would do some stretching and some foam rolling before you go to bed, and then move a little bit before you stand up. Most of us, what we do is just roll over and then we stand right up for the day. Spend 2 or 3 minutes moving around. Hopefully that will help a little bit. But it's a very broad problem. So there's a good chance that there's a broad cause and a broad solution to it. John and Kathleen O'Donnell, thanks for coming, and you're welcome. Cynthia, who's asking if I have a foam rolling class. I have a couple of self-massage classes, and so these are based around foam rolling. I would actually like to create a foam rolling class. I'll probably put it in the future in the list of courses I'm going to make. I'm making a lot more courses, almost one a week right now. And so there's going to be a lot of them coming on a wide variety of topics. An entire foam rolling class, I think, would probably be good, probably because I point to foam rolling in a lot of other courses. So I don't have one specifically, but there's one that's very close to it that is called self-massage. So we have some self-massage courses, and that is mostly very foam rolling oriented. So I would go and find those ones. Arlene is asking if Better 5 is planning a class for core strengthening in a chair. It's funny you mentioned that. Literally started recording it this week. Yes, it's coming. It'll be a little while before it shows up, but yes. Core strengthening in a chair it's one of the things that I decided I really wanted to put out there because I think it's a really important entry point. So yes, we have one coming. I don't know when it'll be published, but it's in the pipeline, so stay tuned. Next one is I have GERD and have trouble with ab exercises causing heartburn and reflux. What can I do to safely strengthen my abs? For the most part, again, strengthening in the chair will actually help, the core strengthening in the chair. And for the most part, I would actually, cardiovascular exercise will really help in these scenarios because of the way it trains your diaphragm and can help with GERD and other such things. But for the most part, you can also just try to alter a lot of the things that we do. That should help. Susan's asking a follow-up on Spondy question. I was told by my osteo doctor to not do weight-bearing activities. You're suggesting weight exercises as a way to strengthen. Yes, I am going to generally say anyone that's telling you not to do weight-bearing exercise is very likely relegating you to the realm of being fragile. And a spondy does not make you fragile. If it's a destructive spondy, meaning it came from a cancer or it came from an injury, that's not good, but most spondies aren't like that. Most of them you can strengthen around. You're not going to go and do a CrossFit class anytime soon, but you need to actually exercise. It's the way that you do it. Telling someone to avoid weight exercises is essentially telling them you need them to be weak the rest of their life, which is no way to live. And I'm not saying that your osteo is trying to intentionally do that, because very clearly they likely have your best interest in mind, but the right amount of strength training done over time with low risk to your spondylolisthesis will do wonders to help it stabilize and help it feel better. So for the most part, if you, because I'm not walking through it personally, I would find a really good kinesiologist or a human kinetics person, and someone that strength training is their primary thing that they do, a personal trainer even, depending on what kind of personal trainer they are, because they're going to want to design it specifically for you. But avoiding weight exercises is good advice for very, very few people, unless they are in the acute stage of an injury. Which spondies are very seldom acute, meaning it just happened. Usually it's over time. Got one more question here. Barbara, 66, female, always been athletic. In the last 6 months, I've developed fibromyalgia. I just freaking hurt all over all the time. Still very active. Staying in motion helps the pain. I guess that wasn't a question, but for one thing, you want to go see someone. It's really easy to freak yourself out by using the internet to convince yourself you have fibromyalgia, and there are a lot of reasons that you might hurt that are not fibromyalgia that you might want to get addressed. Could be autoimmune diseases, could be Lyme disease, it could be some major stressor, it could be menopause complications, it could be a lot of different things. So if you hurt all over, don't self-diagnose with fibromyalgia, because for one thing, that's a really, really poor mental prison to put yourself in if that's not the case. You don't want any undue stress from that. Make sure you go see someone, but definitely stay active. Exercise is one of the #1 things you can do, all forms of exercise, to make you stop hurting, or to keep the hurt from progressing. So that's it. We're done. Look at this, just coming in almost exactly at 60 minutes. Thank you everyone for coming. I love doing this. This is actually really fun for me. I love answering these questions because I don't see very many patients in the clinic anymore because I'm so busy with teaching and doing a lot of other things. So this is really fun, gets my mind back into it. I look forward to doing this again with you guys. I love answering your questions. Keep them coming. Hello again from Western Canada, and I will see you guys again next time. Take care. And done. Yay!